All right. Well, everybody, on behalf of Braver Angels, I would like to thank all of you for coming out to our debate tonight. I'd like to call this debate to order. The resolution on the table is resolved. The federal government should mandate mask wearing in public spaces. I am now looking for a speech in the affirmative.
I think you said I was supposed to start or no?
Oh, yes, Susan Meredith, yes.
Sorry.
All right, Susan, you have 4 minutes, and I will let you know when you're almost up on time.
Thank you. I'm in the affirmative that the government is supposed to protect us from harm. So the government should mandate mask wearing and social distancing. And I'd like to start by saying that I think all of us want schools and the economy to open. And I think it may not be clear, but the people who don't wear masks and social distance are the ones who are stopping us from being able to do that, because it's really about risk. I can't risk going out when I know there are people out there that are not social distancing and wearing masks. And so if I knew everyone was, and there were consequences if they didn't, then I wouldn't have, I could risk going out. Right now, we're restricted to, my husband actually has stage 4 cancer. We really can't risk, I can't risk getting sick and getting him sick. So we're really restricted to going to parks. Now, if I knew that people were actually, following these rules, even like in the when we go running and biking, there are people, what happens is, when people aren't around, we have our masks with us. As soon as somebody comes anywhere near us, we put them on. So it's not that restrictive. And so it is about risk. And I was going to say there's something about risk. You still have risks. I fell and hit my head, tripped on a root. So there's still risks. But if I knew, then I wouldn't have so much trouble. So, I guess I would say that we're individuals as well as part of society. And so really the government makes decisions for us as a society. And there is precedence for doing these restrictions. It is a criminal transmission of a communicable disease. There's a precedent for that. It is criminal to knowingly transmit a communicable disease. So, the government, is supposed to make sure that they protect us from harm. And so when we know that people can transmit this, to other people, it's not just like when we wear a mask, we're protecting other people. And we have no way of, making sure people are protecting us, because the mask stops you from, spraying on us, and like I say, we can't go out. We would love to start the economy again. We would love to go to movies and restaurants and stores. Our money is not circulating through the economy. The economy is about circulating money. And so if you want the stores and the economy and the schools to open again, everybody wear masks, everybody social distance, then we can risk going out in public again, all of us. So that's why the government needs to mandate, because it seems that that's the only way, and they should be protecting us from harm. And I yield.
Thank you very much, Susan. With that, we have time for 2 questions of the speaker. I see a hand up from Tomer Applebaum. Tomer, would you like to unmute yourself and ask a question of what the speaker just said?
Yes, sir, dear chair. First of all, let me preface my question with a statement that I'm not sure the law that you were quoting is relevant. It seems
the law the speaker was quoting.
The law the speaker was quoting is relevant. It seems to me that it would be more like a case where somebody with criminal intent or just negligence lets a disease out of, a lab or something to that effect. But I'm not that educated about it, and it's a side note, so I want to ask the speaker a question. The question is, whilst I agree that it would be good for as many people as possible to be considerate of other people, and whilst I feel for the speaker about her own personal exacerbated risk in her family, do you think that it is correct? Does the speaker think that it is correct that there will be limitations to the Constitution and to the Bill of Rights dependent upon levels of risks? Like the speaker said, all activities have a certain level of risk, including walking down the street. And at what point does the government get to mandate our behavior in that respect? That's one. A second question is...
We have to reduce it to one question per speaker. So, but I sense, Tomer, that you would like to make a speech moving forward. So definitely be sure to have your hand up in future calls for speeches. So, yeah. Thank you, Tomer. All right, so Madam Speaker, the question on limits.
Yes. Well, the point of there's already laws on the books about if someone knowingly infects people with a deadly virus, it would be a crime if somebody knowingly affects people. So if I knew it would be that if I knew there was consequences to somebody doing that, then I know that the people that are coming out and circulating are people that do not knowingly have virus. And I also know that, we are to be protected by our government, protected from harm. It's no different than they stopped smoking in restaurants. It's no different than we wear seatbelts. It's no different than things that, protect us from, that we agree as a society. Like I say, we're individuals and we're part of a society. And so we as a people, as a society, have to agree what is going to cause the least harm. And in this case, we know that it causes death, if I can be sure that the risk is small because everybody is following the rules and agrees that, yeah, I'll do that because it's good for all of us, it'll get our economy back and our schools back. By not doing it, we're stopping our economy from coming back because we can't go out and spend money.
Thank you, Susan. And with that, we will take one last question for the speaker. I saw John Palmer's hand went up first. John, would you like to unmute yourself and ask a question of the speaker?
Okay. Yeah, Mr. Chair, would you ask the speaker, there's been a lot of statements made, positive statements, and just like to know what randomized studies show that masks are effective in any way in stopping this?
Thank you, Mr. Palmer. Susan?
Thank you. I'll answer that by somebody else who asked me on Facebook about this. And my answer was, if you really wanted to know, you wouldn't be asking me. There's plenty of stuff out there from the check with the infectious disease specialists, not doctors in other things, not politicians. Infectious disease specialists can give you all the studies you need, and it shows that masks and social distancing does work.
Thank you, Madam Speaker. And just to keep within the rules of addressing people in the third person, the chair interprets the speaker's use of the word "you" as a broad, generic use of the word "you" rather than a specific use towards the speaker. But just a thing to keep in mind in the future. No worries at all. You did great.
Yeah. So, one would look it up. Yes. Thank you.
With that, the first speaker is thanked, and we will go on to the next speech. I am now looking for a speech in the negative on the resolution. A speech in the negative. Hank Fay. Hank, please unmute yourself, and you have 4 minutes.
Thank you, Mr. Chair. I look at our dilemma here being one of what works and what doesn't, what's practical, what isn't. And for me, it comes down to 2 things, both practical, but also what really helps human behavior change. I'll deal with the practical, but the first part of my answer starts when I was 8 years old. I was an everyday go-to-mass Catholic, and I was every day And on Saturdays at 4 o'clock in the afternoon, I'd go to the church and do my weekly confession. I tried to make it fast because I wanted to get back for Victory at Sea, which started at 4. But I would do what I was told was a good thing to do, and so I did it. Except one week, I showed up, and I didn't have anything I could think of that I had done. So I went in and said, Father, I don't know what to confess because I can't think of anything. And he said, well, Hank, have you committed any sins against charity? And I said, and my first thought was, oh my God, I missed something in the catechism because I don't remember that one. And he said, and then he gave me some examples. Were there times where you wished that you could do something to make someone be uncomfortable? Were there times where you could have helped and you didn't? And suddenly the light bulb went off. And it's a light bulb that has ended up guiding my life. And it's the light bulb that changes people's behavior. For me, it fit right in with whatever else I had learned there, of course. The practical part is that if you look at what mandating masks has done, the data is actually quite clear. I'm a great believer in science, by the way. Wearing masks, yes, I've read the infectious disease experts. I was really mad at the CDC for ignoring what the infectious disease experts for a while. And yes, wearing masks works. What doesn't work, though, is trying to change behavior by threatening consequences. That works up to a point, but it doesn't work in the way it does in a country where all the power is centralized. In our states, we have state government and we have county governments, the sheriffs, and cities, their police departments, and none of the things ordered from above make it all the way down, and there's a lot of variability, and that's actually a healthy thing for society. And so what we see is that there are places where we do have a high enough percentage of mask wearing to cut down the transmission rate, but there are places where we don't, and we keep missing. And I think a concerted effort to engage people in the heart at all levels of government, that's something that everyone, I think, can agree to, would have much more effect than relying on consequences. And that's why I don't think we should mandate wearing masks, because we need to do the other thing.
And with that, the speaker is thanked. We now have time for 2 questions for the speaker. So if you have a question for the speaker, please feel free to put up your little blue hand. And also, as a chair's prerogative, Mr. Speaker, as a fellow Catholic school kid, I can assure you that that one time you went to confession and didn't have any sins to confess, you definitely had something or other. So.
Yeah, Mr. Chair, I beg to differ, but there were times I had to do the Stations of the Cross in addition to a bunch of other prayers too.
Thank you, Mr. Speaker. All right, in that case, we will go ahead and take 2 questions for the speaker. First one will be from Deborah Pine. Deborah, please lower your hand and ask a question of what the speaker said.
Okay. See if I can lower my hand. Hi, Mr. Chair. I guess my question is to the speaker. Does he believe that a mask mandate would make people use masks less? If that is the case, and also if he believes masks are helpful, which he implied, wouldn't a mask mandate improve somewhat the use of masks?
Thank you, Deborah. Mr. Speaker?
Yes, I thank the questioner for asking that question. That is, that masks work is a matter of science, but it's also true. You have to reach a certain percentage of people wearing masks consistently, especially in indoor settings, in order for there to be enough to lower the transmission rate far enough so that we're not building up more and more cases. and failing to meet that, mandating it and then still being below means that things will drag on and drag on and drag on, as they are in most parts of the country, including Kentucky, where I live, where the governor has done a great job.
Thank you, Mr. Speaker. And with that, we will take, I think we actually, I'll start taking 2 questions start taking 3 questions for the speakers, just given that we have a lot of hands being raised and we're going along at a pretty good clip here. So I'll take 2 more questions for the speaker. First one will be from Mike Friend. Mike, would you please unmute yourself and ask a question of the speaker?
Absolutely. First, can everyone hear me?
Mute yourself again and then unmute yourself. I think there might be an audio problem.
How about now? I know my microphone isn't the best.
Mr. Speaker, can you hear him very well?
Yes, I can.
Okay.
Good. Excellent.
But if we stretch that tin can a little further, get string a little tighter, it'll work much better.
First, Mr. Speaker, I would like to commend the chair on his nuanced argument. I am personally in the affirmative on this resolution, but that's the kind of nuance that I come to these debates to hear. My question is, if the speaker doesn't believe a mandate would be the most effective way to change behavior, what are some things that he thinks would be more effective? Is it a matter of incentive or education? What would be better?
Thank you very much, Mike. Mr. Speaker.
Thank you, Mr. Chair. Yes, I really appreciate the speaker's question because it gets at the very essence of government. Government comes when we are enlisted in common cause, not when we're mandated. And how do we enlist people in common cause? Well, we paint the picture for them. Life can be this way, life can be that way. What way are we going to do it? We're painting the picture negatives now to tar the other side. But we could be pulling together at all levels of government, saying, hey, we can work together to make things better in every respect in our communities. And I think until we make that kind of change, we're not going to see the kind of results we need.
Thank you, Mr. Speaker. And as I mentioned, we will take one last question for the speaker before going on to our next speech in the affirmative. But real quick, Erica, would you like to unmute yourself and ask a question of the speaker?
Hi there. Yeah, I'm wondering what the speaker thinks in terms of, does he see a difference between the efficacy of enforcing a mask mandate compared to enforcement of other public health and safety laws that we're already accustomed to, like, maybe traffic laws would be a good example we're all familiar with. What does he think would make enforcement of a mask mandate less effective? Thank you.
Thank you very much, Erica. Mr. Speaker?
I love that question, Mr. Chair, from the speaker. The questioner. Back in the old days, and remember, I am so old that I put the seat belts in our 58 Chevy. I had to drill the holes and put them in because it didn't come with seat belts. Now, they were trying to get people to wear seatbelts, and they had a bunch of ads that said, basically, you don't wear a seatbelt, you're going to die. And this is in Connecticut. And they were able to do a study because they then changed the ads, and they measured the effect on seatbelt wearing. Then they changed the ads to, buckle up means I love you. And people use their seatbelts more. The problem with mandates is that we don't have the kind of government control of people that that people do in highly dense areas, and where there's one level of government in effect. And so the mandate is going to be enforced at all levels of application of government, as opposed to basically different governments. and that makes the difference. That's why a consequences approach is failing and will continue to fail to get us to the point where we need to get the curve down to 0.
Thank you very much. And with that, the speaker is thanked. By the way, I apologize. I have chair's prerogative, but I believe I also made a chair mistake, is that I forgot to tell everybody what jazz hands are. So real quick, in a Braver Angels debate in person, in what the cyber nerds like to call meat space, if we did not have to worry about accidentally infecting each other, there's usually a lot of applause. You usually do what's called banging, or you do just normal clapping, right? But in online debates, in place of that, we do jazz hands when somebody says something that they like. So even if you didn't like what I just said, please do jazz hands so I know that you understand what I just said. Okay, great, cool. So, and please feel free to do that over the course of this. And let's give that round to the first 2 speakers who have kicked this off very well. So, all right, well, with that, I am now looking for another speech in the affirmative. So just as a reminder, the resolution is resolved. The federal government should mandate mask wearing in public spaces. I'm looking for a speaker in the affirmative. I see Carlos Hernandez. Carlos, would you like to unmute yourself? You have 4 minutes.
Thank you. And in the spirit of the debate, I've come prepared. First, I want to express gratitude. Normally, we're inside in the courthouse, the Braver Angels courthouse, but now we're outside in the Braver Angels town square, hence the mask. And now I want to cover ethos. This is a Braver Angels debate, not a food fight. So in the square, I see reds with their guns. I see blues with their signs of protest. That's America, but have a mask. Now, the most stable structure on earth is the following. A tripod. I'll get my face out of the way. For a tripod to be stable, it needs to be balanced. One leg of the tripod is liberty. That's one of the great things about this country. Oh, I need to change my mask because I am a patriot. There we go, patriots. The second leg of the tripod is intelligence, commonly measured as IQ. The third leg of the tripod is common sense, measured in EQ, emotional intelligence. I think we have seen evidence in our great nation of things being out of balance. Those claim liberty, they're adamant. If you're so brave, I dare you to wear no mask and walk into an ER room. That's a personal friend of mine. That's how she got dressed to work in the march. You're that brave with your liberty? Go into the ER room. Go to ICU. Witness body bags. Hopefully they weren't a relative of yours. Now, I also have another principle I believe in. I'll end with this. E pluribus unum, Latin, forgive the mispronunciation. It's on the back of a quarter. I'm not trying to change my mask. Well, maybe get one more comfortable, a gaiter. Excuse me, I'll get my gaiter up here. It means, in English, out of many, one. For those of you that love Star Trek, there was a scene, Star Trek 2. Spock tells Kirk, the needs of the many exceed the needs of the one. So, ladies and gentlemen of the Braver Angels Courthouse that's outside the public square, spend your liberty wisely. Spend it wisely. Thank you for the privilege of addressing the Braver Angels audience.
And with that, the speaker is thanked. Thank you very much. We will now go on to 3 questions for the speaker, so feel free to put up those little blue hands. And may I use my chair's prerogative to just congratulate the speaker on the effective use of props and backgrounds for creating a higher level of pathos than most of us are usually able to do. Give him a round of jazz hands. All right, so with that, we'll take 3 questions for the speaker. I see a first question from John Barrett. John, would you like to unmute yourself and ask a question of what the speaker said? John?
I think I'm unmuted. Thank you, Mr. Chair. Can you hear me?
Can hear you just great.
Oh, good. To the speaker, to the gentleman who just spoke, thank you. If you could please...
If the speaker could please.
If the speaker could please provide for us just one source that gives scientific proof, meaning from a scientific study or a statistical study, scientific study proving the efficacy of masks, proving that masks actually work. Usually when I ask someone that, they say, oh, well, just go to the CDC site or just go listen to Emperor Fauci or something like that. Or as one of the earlier speakers said, check with the infectious disease experts. And all of those, in my opinion, are an appeal to authority. I would appeal to science and ask anybody, including the speaker, Mr. Chair, if they could, moving forward when discussing this with friends and family, and in this format in particular, be willing and able to provide actual science as opposed to just referring us to authorities. Thank you, Mr. Chair.
Thank you, John. Appreciate it a lot. Mr. Speaker?
Mr. Speaker, please remind the questioner that that sounded to me more like a speech than a question. Questions end with question marks. Please remind that to the speaker, questioner.
Mr. Speaker, I take it as a question. The questioner was asking primarily about just a scientific study. So, yeah.
Okay. One thing I've learned in Braver Angels is not to go into a rabbit hole when someone poses a question. We're taught to pivot. Here's my pivot. I was wearing a mask as far back as January. Why? I had no idea about COVID. I live in San Francisco. I ride buses, subways, and I walk. I'm exposed to the general public. I started wearing a mask so I wouldn't get any flu nor a cold, because I know my personal history of what it's like to get sick as far back as January. That's my answer to your question.
Thank you,
Mr. Speaker.
Thank you, Mr. Speaker. With that, we'll take another question for the speaker. I saw David Ulmer's hand was up. David Ulmer, would you like to unmute yourself and ask the question of the speaker?
Yes, and so I'll try to keep this one short and focus as a question, Mr. Speaker.
Thank you.
Could we ask the gentleman speaking, why would we just limit masks to this pandemic? Traditional flu kills thousands every year. Measles are making a comeback. TB isn't gone. There are numerous airborne viruses that kill thousands of Americans every year. I will certainly grant that this one is a little more effective against certain age groups and demographics. But I mean, if the concern is saving every last life, and if government has that responsibility, especially at the federal level, if that is your position, why don't we always wear masks all the time?
Thank you, sir. Mr. Speaker?
Thank you for the question. And I don't think I recall, I didn't use the phrase save every last life. So I'm going to pivot from your question, and I'll answer it this way. Let's say you and I can agree to have common ground. I am willing to have a sentence in the legislation that allows for exceptions based on common sense. That's my answer.
Thank you very much, Mr. Speaker. And with that, the speaker is thanked. So I would just remind everybody that this is, as we all know, a very fraught and controversial and emotional subject. And I only ask that we do our best to keep within the parliamentary procedure of this, just to keep things flowing along and keep questions directed to me. Remember, if you're angry at anybody, direct it towards me, not to anybody else over the course of it. So, actually, I guess my whips too over chat, but vocally to me. So, all right. So with that, we're going to move on to the next speech. I would like to ask for another speech in the negative on the resolution. So if anybody would like to make a speech to the negative, please raise your blue hands. I see Tamara Applebaum. Tamara, would you like to unmute yourself? You have 4 minutes to speak.
I would posit a couple of things. First of all, there is a certain level of danger involved in being alive. Ultimately, it is a fatal disease. You will die. Sorry to break the news. But the thing is, we have values of freedom in this country, which I value very much as somebody who is both Jewish and have family who survived Marxist Russia. So I do not take these freedoms for granted, and I am concerned about their being removed. I'm not against people wearing masks. I'm not for forcing people to walk without masks. The question at hand is, should the government mandate mask use? And I would posit that we do a lot of things that are dangerous to our surroundings on a daily basis. I have the habit of getting into my car and driving on a daily basis. And statistically, one of the people who does exactly the same as I do every morning will kill somebody or himself or his loved ones doing exactly that exercise. About 30,000 people die a year driving cars. And yet we still allow people to drive cars. We put certain limitations in it. We demand people jump through certain hoops in order that we allow them, but there's always a certain level of risk. Now, there's also a certain level of risk with the disease. If you compare it with smallpox, for instance, which has had a case fatality rate of 30%, that's one conversation. The case fatality rate for this is closer to what we know from the common flu. And hence, it's also very, very transmittable, because it doesn't kill that many people. It transfers very, very fast. I recently read research from the CDC that posited that 94% of the people who died from COVID had pre-existing conditions. So it's highly dangerous to a certain subset of the general community. And there is a question whether it's fair to stop all of the community in order to serve the minority. Now, there's not only the question of whether it's fair, there's also a question of what are the effects of it. Everybody talks about preventing death. Nobody talks about the fact that we are paying for that prevention of certain people's death with the death of other people in weaker countries. I believe it was the World Health Organization I read, either that or the UN, projections of worldwide starvation doubling as following as the shutdown. And the numbers estimated were an extra 120 million dead in next year. So we're preventing the death of, call it 5 million at the expense of 120 million people who are granted are from third world countries, and maybe we want to have a conversation about their lives being worth less. Furthermore, there are effects to shutdown that people are not talking about. I have 3 children. The eldest is 12-year-old. After half a year of being locked up at home, she is not doing very well. She's definitely suffering from anxiety, from depression. I've seen a recurrence of temper tantrums in a 12-year-old. It is very concerning to me. There's a reason they punish people in prison with isolation. It's because it drives you insane. It hurts, okay? So I'm not saying what is or isn't the right thing. I'm saying there's definitely a conversation here, and it is not clear to me. Furthermore, as a matter of public health, I'm not convinced that mask wearing is actually the correct move as a question of public policy. Because whilst obviously you are reducing the spread of everything that's coming out of you breathing-wise when you wear a mask, what you're also reducing is the rate at which we have herd immunity. And Sweden, for instance, already seems to be out of the black. And,
Mr. Speaker, you have 30 seconds.
And very, very active. Israel, which has been very, very quick to shut down the country, is having a huge recurrence right now. So it might be that the wiser policy to save more lives would have been to make sure that people at risk are very, very isolated, places like retirement homes, etc., and everybody else continue business as usual, reach herd immunity as fast as possible so the people who are at risk can join back in the general activity as soon as possible. And how do I finish? I rest my case?
You can do that. You can also say, I cede the rest of my time to the chair.
Do I have any time to sit there?
And with that, the speaker is thanked. All right, so we now will take 3 questions for the speaker. First question will be from Richard and Lydia. Richard and Lydia, please unmute yourself and please let us know as well which of the two of you is going to be asking the question.
It'll be me, Lydia. Hi.
Thank you, Lydia.
Thank you. Thank you to the speaker and Mr. Chair. I would like to ask the speaker, how would one figure out who is the most at risk? In my own personal experience, the reason why I ask is my own personal experience is that I'm afraid to go get tested because then the community in which I live, I have to sit for 2 weeks at home and do nothing. And I can't, it's like, oh, I don't want to go get tested because I want to be able to do it, but I don't also want to, transmit the disease. I personally would be asymptomatic if anything. But so it's that fear. How would the speaker figure out, do you require people to be tested? That's kind of like the mandate for the mask. I mean, I understand, but I think that getting people, I'm sorry, I'm being not very clear. How do we find out who is the most at risk for spreading the disease? How do we, that's maybe a whole other ball of wax, but that's my concern. Thank you.
Thank you very much, ma'am. So, Mr. Speaker, the question is along the lines of how do we figure out...
I understood the question. How long do I have to answer?
Take no more than a minute.
No more than a minute. I feel like it's not racism in this case, but the low expectations of assuming the populace is idiots and can't judge for themselves whether they're a risk or not, I highly, highly suspect that. We live in a democratic republic, and I very much appreciate it. Most people know if they're at risk. They know if they suffer from breathing problems. They know if they're over 80. They know if they have trouble going up the stairs, if they're obese, etc. People know if they're at risk. Now, the point that you raise about people being afraid to get tested because they don't want to be limited by the fact of being tested, they're waiting for an answer, that is exactly the case in point. What you're doing is you're creating a culture of virtue signaling in order not to be punished. So people walk with the masks on their ears or they put their nose above it and or whatever, and I'm wearing the mask, and they avoid getting tested even though they suspect they're tested because they're afraid of being punished. I would go for education and not for forcing people to do things that they don't want to.
Thank you, Mr. Speaker. And as a just reminder to everybody, the chair chooses to interpret the speaker's usage of the word you as a general you rather than a specific you referring to any particular individual in this room. So,
but of course.
All right, we have room for two more, but just please keep that in mind, everybody. We have room for two more questions of the speaker. Larry Kittiver, would you like to unmute yourself and ask a question of what the speaker said?
Mr. Chair, I'd like to know from the speaker. I agree with him in many ways about what he said. The disease attacks people in different ways, different conditions. But he didn't say a thing about why we shouldn't wear masks. It seems like it makes common sense to wear it. It seems to have been effective in bringing down the pandemic. I agree with the idea that seatbelts were the same way, and so is smoking. And eventually other types of bad things are going to be mandated out of existence. But he didn't say a thing about masks. So why? Could I ask him, like to ask Mr. Chair, I'd like to have the speaker tell us why he didn't talk about masks.
Thank you very much, Mr. Kittiver. Mr. Speaker.
Thank you very much, Mr. Kittiver. I think that's a very good point. I didn't say anything because I'm not against wearing masks. I have no proof that it is a bad idea. What I am against is the government mandating people's use of masks. People are intelligent. This is a free country. People can make their own choices for themselves. Look, there's a certain spectrum, right? We don't allow people to start forest fires, but we do allow them to speak their minds. We do allow them to drive their cars. We do allow them to party and celebrate. We do allow them to some extent to smoke and to drink alcohol. There's certain freedoms that I am very, very hesitant to limit, especially when the people who are proselytizing about it and making it like a virtue thing, they don't actually know. Nobody actually knows what's the correct public policy thing. It is 100%, I feel, let's call it 90% obvious that people are high risk. Retirement homes in New York, where I live, that Cuomo forced retirement homes to accept people who were sick with COVID, that was a bad idea. 10,000 people died. That's obvious. The fact that closing my kid's school does anybody any good, I am unconvinced of the evidence.
Thank you, Mr. Speaker. And we'll take one last question from the speaker from Jim Herm, who has not spoken or questioned yet. So Jim Herm, would you like to unmute yourself and ask a question what the speaker said?
Yes, Mr. Chairman, I'd like to have a answer for the question from the speaker regarding, he mentions that many people who have become ill and died from it have pre-existing conditions, but it is, to my knowledge, that many people who do get the virus don't die, don't have pre-existing conditions necessarily, but they have weeks and months of lingering issues with joint pain, depression, heart problems, fevers, and so forth that must be acknowledged. And to this date, we don't know for sure how long people are going to suffer from those conditions. Would it be positive then to have people wear masks and to social distance to prevent the general public from getting the disease?
Thank you, Mr. Herm. Mr. Speaker?
I have no issue with people choosing to social distance. I have no issue with people using masks. Many people suffer more. Many people don't suffer at all. They don't even notice that they got the disease. What I am against is forcing people to stay at home, shutting people's businesses down like they did in my case, messing with kids' school like they did with my children. This is what I'm against. It is not a good idea. I feel like government should follow the same idea like medicine. First, do no harm. Okay, there used to be a principle in this country of limitation of government. This country was founded on a principle of the freedom of the individual, which was a revolution. That was not the normalcy in the worldwide at the point. And we are gradually eating away at that idea. And that is far more concerning to me than the threat of COVID. That will kill you much quicker than COVID, 100%.
Thank you very much, Mr. Speaker. With that, the speaker is thanked. And I just want to say, as the chair, I've actually been surprised and impressed by the quality of some of the back and forth in this this debate. These are questions that I haven't thought about before, and so I'm just interested to see where these are going. So, all right. So with that, I'm going to call for a speech in the affirmative on the resolution. And I'm going to call on Arlene Grant to give this next speech. But before you go, Arlene, somebody brought to my attention that perhaps some people might not know how to use the blue hands function, so I'll just run you through that for just a moment. If you go to the bottom of your Zoom screen, you'll see a button that says participants. If you click the button that says participants, that will open up a participant list on the right side of your Zoom screen. You can see everybody, and if they have their camera on or their microphone on, et cetera, et cetera, et cetera. When you go see that, at the bottom left of it, you'll see a little blue hand. If you click that blue hand, that puts your hand up. If you unclick that blue hand, that puts your hand down. And that's the primary way I'm calling on people. If you chat to your whips and you don't put up your hand because you are having trouble putting it up, I can get access to you through there too, and so that might work. But I prefer using everybody using their blue hands so far as they're able. So, all right, with that, Arlene Grant, the floor is yours. You have 4 minutes, a speech in the affirmative.
Thank you, Mr. Chair. To my fellow speakers thus far, thank you. I am in favor of wearing masks, and I wish that the resolution be affirmed. And I have an interesting story in that initially I was not in favor of wearing masks. And I was concerned about the efficacy issue. I was concerned about reports of children smothering from wearing masks. I was concerned about people feeling a loss of liberty and rights. So those were the 3 things that initially had me concerned about a government mandate. From a human perspective, I felt that people should want to wear masks because, as was mentioned by an earlier speaker, wearing a mask is akin to wearing a seatbelt to say, I love you to your fellow Americans, your fellow visitors on this planet Earth. So as time progressed and the pandemic advanced, I came to realize that people were not really good at saying, I love you and I respect the right that you have a right to live. And as time progressed, I learned that children under the age of 2 should not be required to wear a mask. And as time progressed, I learned that even though there are comorbidities that could impact people, the efficacy of the mask was much more significant to say, wear a mask. I do agree that it is important to consider the way in which we say things, and to be belligerent and belittling to people will make them have pushback. I'm also aware that there is scientific proof. Personally, I respect Dr. Fauci, and I believe that Dr. Fauci censored himself rather than acting as the elite authority on the matter. I do believe that the science is there, and if anyone would like to refer to the University of California, San Francisco website, they do have quite a bit of information regarding the efficacy of masks and scientific proof to explain why, even including a peer-reviewed article that is as far back as April of 2020. I believe the date is April 10th. And they gave some more updates on that on June 26, 2020. They're not being paid to do that. They're not being paid to say that. My mom is older. Unfortunately, my dad has passed away for cancer. So I do care about more than my parents, though. I care about society. And I do believe that wearing a mask is essential to protect somebody else. And it should not be an issue of rights being censored. There was a previous speaker regarding the use of a deadly weapon or infecting somebody with a disease. It is true. That is a crime. And there are people who have knowingly attempted to infect others with COVID disease. That's not up for debate. That's fact. There are people who have unknowingly infected people and seen their parents pass away and people that they love and care about pass away. So the simplicity of the situation is that there are quality masks that are available in the marketplace. There are masks that are designed not just for fashion and fad, but for efficacy that you can breathe. There are some masks that are difficult to breathe with, but we don't necessarily need to have a ventilator. A face covering is simply saying, I love you, I respect you, and let's work through this. There's somebody with a backdrop that says we're all in this together.
Ms. Grant, you have 30 seconds.
Thank you, Mr. Chair. We're all in this together, and wearing a mask is shortening the time that we're all in this together. There are countries that have been able to reduce the rate of infection and also the number of cases. And Canada, which is our neighbor, just recently reported 0 cases. How are we doing? It needs to be less of a personal issue and more of a one country, as another person spoke to, being out of one, we are many. Let's get through this together.
Thank you, Ms. Grant. With that, the speaker is thanked. All right, we're going to have time for 3 questioners, and just so everybody knows, so that I'm being totally transparent here, the way I go about selecting questioners is basically based on I look to see who's talked before, and if people who haven't talked or questioned before have their hands up, I try to get people in. So, but once we get through a lot more people, I will definitely be calling on people multiple times. So feel free to keep raising your hands. All right, so with that, I saw Gary Kirkland's hand is up. Gary Kirkland, would you like to unmute yourself and ask a question of the speaker?
Sure. The question I'd like to ask is, one, what freedoms don't we give up? And do we give up all our freedoms? But the second question is, of what should people die?
I'm sorry, I didn't understand the second question.
Oh, of what should people die? Should they die of old age?
Okay,
Of
so
what?
I'll take your questions in answering the last one first. As someone who lost my parent and my grandma and people that I've loved and my uncle, all like in short periods of time, except for my grandmother, losing, I guess, 3 family members, nobody from COVID. I would say that it is not for us to decide when it's appropriate for another person to pass away. And it's not for us to decide that our liberty should in any way impact the value of somebody else's lifespan. That is us trying to play God. And I am a Jewish woman, and I would say, no, I believe that there is a God and it's not me. The next thing is to your first question, Could you repeat that for me, please?
Oh,
Sorry.
you're back on mute, Mr. Kirkland.
The speaker, what liberties should we give up in order to make sure we don't die as soon as we're going to die? We are going to die. So what liberties should we give up in order to make sure that we postpone our deaths, because nobody lives forever?
Thank you, Mr. Kirkland.
Okay.
Thank you to the speaker for repeating his question. With regard to what liberties we should give up in order to ensure that we live, I'm not sure that wearing a mask is giving up a liberty that's a true liberty. There's the pursuit of happiness. There is the pursuit of happiness. So if a mask makes you unhappy, if the mask makes someone unhappy, then I think it's imperative to consider why does a mask make someone unhappy, knowing that there are others that are a risk. So if a person's concern is not about their lifespan, then what about the lifespan of somebody else? Have you ever loved anyone that you would like to see them live forever?
Thank you, Ms. Grant. And we will take another question from John Barrett. John? John, you're on mute.
Okay. Thank you, Mr. Chair. Question to the speaker. I'm wondering if you have found any research. I'm wondering if she has found any research out there about cancer and the number of cancer patients that will die in 2020 due to the bureaucratic and political response to COVID, not to COVID itself. According to the former cancer specialists with the WHO, we've seen many stage 1 and stage 2 cancers go to stage 3 and stage 4 because they've been kept out of hospitals. Stage 3 and stage 4 cancer patients, it's very sad. You experienced that in your own family, not necessarily because of COVID, but people dying from cancer, dying from anything is sad. But,
Mr. Barrett, please make sure to ask us a question, please.
Sorry, yes. So that is the question. Have you done any research on that? Have you heard that has the speaker heard that the former cancer specialist with the WHO estimates there'll be an additional 100,000 people that will die in the United States this year due to the political and bureaucratic response and the fear mongering to COVID?
Thank you, Mr. Barrett. Madam Speaker.
Thank you for the question, and thank you for your concern about the passing of those whom I've loved to cancer. I would say that the issue is that COVID, not because COVID exists, is it that people were kept from hospitals. It was because hospitals were overrun with COVID, that there was no room for cancer patients. And because of the compromise of the cancer patient's immune system, whether it be from chemotherapy or other modalities, or the fact that their body just needs to fight cancer and not fight something else, that was the reason that they were told not to come to the hospital. So it's not because of an overreaction to COVID, it was because of an overburdening of COVID. So if the theory and the idea is if people socially distanced and wore masks, then there would be less of a spread, then the hospitals would not have been overburdened. And if there was efforts by the government in advance to not close the Office of Pandemic and to let people know the seriousness of COVID from the very beginning, I'm sure people would have taken steps to comply voluntarily to say to their fellow person, I love you. And by the way, I know you're fighting cancer. Why don't I do my part so that I'm not going to be in the hospital sick or exposing somebody else to being sick, that they are then not able to receive their cancer treatment?
Thank you, Ms. Grant. And we'll take one more question for the speaker. I see Mark from Seattle has his hand up. Mark, would you like to unmute yourself and ask a question of the speaker?
Sure. Thank you, Mr. Chair, and hello, everyone. And Mr. Chair, I just really want to show some gratitude and appreciation for what the speaker is bringing our attention to. I certainly appreciated how she talked about how her own views have changed over these months. And yeah, it just has meant a lot to me to hear her speak. The speaker brought our attention to doing the right thing, loving our neighbor, being in this together. I personally really appreciate that message. So I'm curious to hear how she has grappled with the issue of this word mandate, doing the right thing. I'm wrestling with that, and I would really appreciate hearing the speaker's view of how she grapples with mandating doing the right thing. Thank you.
Thank you, Mark. Excellent question, Madam Speaker.
Thank you so much for your appreciation first, Mark. I love Seattle, and I hope that things are well on the West Coast from my heart. Okay, so now to the question. I believe that it's sad that we would come to a point of mandate, but unfortunately the issue of masks have been so politicized, and there's been so much misinformation that's there that people have bought into the false narrative. And so now it's like saying, you know what, children shouldn't play with matches, right? So we need to protect, and not to say that people are children, adults are children, but I make the analogy to say, you need to protect people from themselves at this point and from the bad information that they've consumed so that they're not harming themselves or other people. I believe that Sturgis is a great example. No offense to the bikers in the world, but Sturgis is a great example to say they were out in public space. And there are cases that are documented with as many as 260,000 people infected. And then, you know, the way that COVID works, it multiplies. It's not a polite virus. So I would say the mandate should be, as our earlier speaker said, it is because we're helping you to say, I love you. And we're showing you that we love you as a country and we want you to be here.
And with that, the speaker is thanked. Thank you very much, Madam Speaker. All right, so we are going to go to onto our next speech now. So I'd like to have a speech in the negative on the resolution. I believe I saw in the chat that Lisa's iPhone would like to speak. Lisa, if your iPhone would still like to speak, please let us know.
My iPhone would like to speak. Thank you,
Wonderful.
Mr. Chair.
Thank you, Ms. Lisa. All right, you have 4 minutes.
Thank you. Thank you, fellow braver angels. I'm coming to you tonight with a negative, an opposition to this proposal. I live in Colorado, where our governor has mandated it, and it is extremely divisive in our state right now for a lot of various reasons, some of which is because our governor keeps changing the goalposts and there aren't any clear expectations. But I want to raise a couple issues maybe that I haven't heard here, that everybody keeps talking about the science. Well, the science is kind of mixed. If you look at all the science for the last 40 years and any studies on masks, you will see that viruses specifically, not bacteria, aren't stopped by masks, especially not cloth masks, not even surgical masks, and sometimes not even the N95s. So the science for the last 40 years has been pretty clear about that. And then all of a sudden we did a real 180, and I don't understand how that all happened. What I don't hear is any of the science being done to look at, are there long-term ramifications for wearing masks? Is there something, it's very different when you're in a controlled environment, like a surgical center where the oxygen flow is maintained and the temperature is maintained and all kinds of variables are there. But for the average guy or gal wearing their mask all day, especially here at higher elevation where there's already depleted oxygen, what are the long-term consequences when we're seeing that some people are having oxygen deprivation? I am highly concerned about what it means for children on an emotional, physical, and spiritual level, what they're not getting in terms of cues. Go into any place, people don't even make eye contact anymore. So kids aren't seeing faces. There's studies now saying that the virus doesn't transmit from kids to adults. So why are we asking that they are mandated to wear masks? That makes absolutely no sense to me. They're starting to see from cloth masks problems with gum disease and some bacterial issues because of the moisture content, which is ew, disgusting. Nobody's talking about those things. What I heard from a previous speaker today too is that, you know, I'm supposed to care about other people. Well, prior to COVID, many people had compromised immune systems. I'm a massage therapist. I work with those people every single day, and I've worked with them for 15 years. And I can tell you, probably split down the middle. Some people are totally against masks and some people are totally for masks. And it's about their ability to choose for them their lifestyle and what works for them. And so there's some strong feelings about that. Way prior to COVID, I would have people who would they would want to wear a mask because that is what made them feel better. They were very good about how they washed. What I don't hear in this whole discussion, I don't hear, why aren't we asking the government to do more in terms of educating people on how to be healthier or how to eat better? I get a little concerned that if we're going to mandate things, where's the line that we're going to cross where we just keep going down the rabbit hole? So you're overweight. Well, you know what? The government says that you shouldn't be overweight. So we're going to mandate how you can buy groceries and what you can buy and what amounts you can buy, because we want to do things that are good for you because we love you enough. So I think it's a little...
So you have 30 seconds.
I think it's a little... dangerous to go down that rabbit hole of what the government should be able to do. And finally, I'll just say, I think that government decisions need to be local. We are not New York. And even in March, when this was all happening, Denver was a whole different climate, a whole different bucket of worms. And so what happens in the mountains in that community versus the plains, they're all different. And we should have localized control, not government mandates. Thank you very much.
All right. Thank you, Madam Speaker. Well, with that, we have time for 3 questions of the speaker. So if you have a question of the speaker, please feel free to raise your little blue hand. I see Erica's hand went up. Erica, would you like to unmute yourself and ask a question of the speaker?
Thank you. Yeah, on the issue of local control, I'm wondering how the speaker feels when private establishments require masking. Does she feel differently about that than she does toward government mandates?
Absolutely. Thank you very much for the question. I totally believe that businesses should be able to control their environment. Here in Colorado, like I said, that once the governor mandated that took a lot away from a lot of control for businesses. So I would totally respect, I mean, don't get me wrong, I will respect the orders. I don't like it, I don't have to like it, but I respect the orders that if this business says this is how we want to do business, then I can either choose to do business there or not.
Thank you very much, Lisa. We have a question from Susan Meredith. Susan, would you like to unmute yourself?
Yeah, I'm hearing like there's an alternative. There's like either we have COVID and we wear masks and everything, and my question is about if it's not between wearing masks and staying inside, you know, like people getting sick because they're staying inside, and, you know, the people going to school, you know, are affected badly because they're having to stay home from school. The point is we want to get over this. It's not that we're going to have to wear masks forever. So, you know, do you see that if we temporarily mandate masks and social distancing, we can get past this where nobody has to be isolated anymore? Nobody has to be, you know, depressed and kept from school and kept from, you know, going out to dinner and everything. That it's if we took a temporary, temporarily did this, you see that maybe that could, you know, not be a long-term thing.
Thank you, Ms. Meredith. Madam Speaker, a question about the temporary nature of the solution.
Right. So the temporary nature of the solution was back in April, or actually March, when we were asked for 2 weeks, and then 4 weeks, and then 6 weeks, and then, maybe another couple months. I don't believe that we're going to get rid of this. If we follow the virus and bacteria kind of history, they're going to be with us. This is SARS 2-19. So this version of this is going to go its path, and then there's going to be something else. So I actually am more concerned about what we're doing to people's immunity systems because we're not out and mixing. I'm surprised at how many people think that strep or colds, actually you can tell I have a cold. I had surgery about a month ago, and so not being on my supplements we do go to bars and restaurants, and we're out doing life. I do believe that we're going to create more problems in the long run because we are now not exposing people to viruses and bacteria that are always going to be with us.
Thank you, Madam Speaker. And I'm sorry, we only have time for one more question, but I'm actually quite curious in hearing Hank Fay's question to the Speaker on this front. So, Mr. Hank.
There we go. Yes, Mr. Chair, I want to ask the Speaker how she would explain the difference between Canada getting down to 0 deaths rate versus our death rate. How is that possible?
Thank you.
Well, I actually don't know that I can speak to that in an intelligent way, other than to say that I have family in Canada and it's not down to 0. So I don't know what the rates are being promoted, but it's not 0.
And with that, the Speaker is thanked.
Thank you very much.
All right. By the way, this is just like putting all kinds of interesting questions in my head. So no need to thank me after this, everybody. I'm just getting a lot of good stuff from this just by being here. So thank you all for being here as well. All right. So with that, we are going to go on to the next speech in the affirmative. Just so everybody knows, we are hitting about the 30-minute mark till the end of the speech. Or till the end of the debate. So I'm going to try to get another 4 speeches in. We might be able to get 6 speeches in, depending on how fast we go through these, but I'm going to try to get at least 4 more in. So with that, I'd like to call for another 4-minute speech in the affirmative. Let's see. I see Rose Sundermeyer's hand is up. Rose, would you like to unmute yourself and give a 4-minute speech in the affirmative?
Thank you, Mr. Chair. I would like to give a speech in the affirmative for the federal mandate, but my reasons are a little bit different than the other speakers have been. From where I sit, the reason we want people to wear masks is not to protect ourselves, but to protect others. And given that people can infect others even though they don't know they're infected themselves, I find that very concerning. I guess I believe that most people would take precautions if they knew where they were infected to not infect others. And since you can infect others and not know you're capable of it, I think mask wearing is a viable option until we can get to the point where we have a easily available check to determine if we're infected or not. It's like the people have rights, but you don't have right to yell fire in a crowded theater. You don't have the right to go out and infect others. The mandate is for public spaces only, and so theoretically you can still have your private faceless mask parties if you want. But even then, I guess I have concerns if you're having a private party that is being catered by a company that has employees that are required to work there. If you have a bunch of infected people running around, shouldn't you have some compassion for the working people who have to participate in those activities? And that's probably not 4 minutes, but I cede the rest of my time to the chair.
That is perfectly doable. Thank you very much, Madam Speaker. All right, with that, we have time for a few questions for the Speaker. So raise your little blue hands if you have any questions for the Speaker. I see Mr. Roger Haynes. Please unmute yourself and ask a question about what the Speaker said.
Hey, Mr. Chairman, thank you very much to you, Braver Angels, and everybody participating. This is a very complex issue, and this has been really amazing. My question for the Speaker, Mr. Chair, is with a mandate of masks, could there possibly be a potential for people becoming too confident and maybe causing more spread with the there's an analogy. Some law enforcement officers I knew did not wear bulletproof vests because they felt like it made them too confident. And instead of protecting them, they felt like they were indestructible. So would a mask mandate do the same? That's my question, and I appreciate your response. Thank you.
And as a brief addendum to that question, as a 20-something-year-old man, I can assure you that overconfidence is often a problem in various things, not just public health. But yes. All right, Ms. Sundermeyer.
Thank you, Mr. Chair, and thanks to the questioner. I do believe that is probably a valid concern, but as somebody mentioned earlier, today we have the concern where people are afraid to go out because they're afraid of being infected by people who are out there spreading the virus. And so I think it is a fine balance between, do you have enough confidence to go out because you feel you are protecting other people in case you're infected, and does that provide others with enough confidence to come out? I live in Minnesota. We do have a mask mandate in the public areas, with the exception of people who have problems breathing in their masks. And we did see more people going out in public once that mandate came about. But it's something that we won't really know the answer to, I guess, until this is behind us for some time.
Thank you. Carrie Sire has a question. Carrie, would you like to unmute yourself and ask a question of the speaker?
Yes, thank you, Mr. Chair. I was just curious or wondering, if you are wearing a mask, you're protecting yourself, but so if you're wearing a mask, you're protecting yourself, so why should you be concerned about the people who are not wearing a mask if you are protecting yourself by wearing the mask?
Thank you, Ms. Sire. And again, I choose to interpret the you in the questioner's remarks as a general you, not a you referring to the speaker herself. So.
Thank you, Mr. Chair, and thanks for the question. And I think this does illustrate the misinformation that's out there. Either I have misinformation or the questioner has misinformation, because the way that I understand it, I wear the mask to prevent myself from infecting you. I don't wear the mask to prevent you from infecting me. My understanding was that the virus transmits through the droplets that we spew out when we speak, and the mask was to stop me from spewing over you. So that is why I worry about people who are not wearing the mask if they're spewing their virus particles all over me.
Thank you, Madam Speaker. And we will take one last question for the speaker from Richard and Lydia.
Sorry, Lydia. This is Lydia. Hi. I will. I really appreciate what the speaker had to say about the mask protecting other people. I had an experience this afternoon with somebody who wasn't going to wear a mask because he said, "You have a mask, it protects you." And I was like, oh, guy, I don't have enough time. I'm not a good enough science teacher to try to teach you why you wear the mask to other people. Sorry, that's my little rant. But for the speaker, I would want to know, does she have any ideas about the best way to educate people? How do we educate the people about, we wear the mask to protect other people? I've seen it so many times, and yet there's this pervasive belief that, oh, well, you're wearing the mask to protect yourself. Anyway, that's my own perspective, and if the speaker has any insight in that, I would really appreciate that. Thank you.
Thank you, Ms. Lydia. Madam Speaker.
Thank you, Mr. Chair. I don't have a good answer to this. I am married to a man who won't wear a mask, so I understand the difficulties people have. From what I can tell, the way to approach the people who believe they don't need masks or shouldn't wear masks is we need to convince the influencers. Most of these people are following somebody they believe is important, they believe is intelligent, and somehow the information is getting garbled. So unless we can convince the influencers, I don't think we have a chance of reaching the people at the lower levels.
And with that, the speaker is thanked. Thank you very much, Madam Speaker. So I'm going to call for speeches in the negative in just a moment here. Actually, if you'd like to make a speech in the negative, please feel free to put up your hand. John Barrett, I'm going to call on you. But real quick, one last thing before we get to John's speech. I just want to let everybody know, as a reminder, this is one of the wonderful things about Braver Angels debates, is that reality is complex. Quite often the data point in different directions and all at the same time, and there are very complex kinds of ways of understanding these kinds of things. And here at Braver Angels debates, the chair does not rule on which of these is more accurate than the other ones. We open the floor for the debates to be had, and for people to share, especially their personal experiences and their personal stories on these fronts. So it is a question that we think about at the debate team quite a bit, but we have found that in general it's better for these debates to be had in the open than for them to not be had at all. So with that, I'd like to call on John Barrett. John, you have a 4-minute speech in the negative on the resolution.
Well, thank you, Mr. Speaker. I am a researcher of 30 years. I take science very seriously. I'm a centrist, a constitutionalist. I'm politically agnostic. I hate all politicians equally. I access a wide variety of sources, including mainstream social media garbage, the corporate media, the for-profit media. I regard that as what most people rely on, and that's patently pathetic. And that's one of the biggest diseases we're dealing with right now in this country. I ask folks, please, when I talk to them, I say, please bring some sources to the table, and not just Fauci said it, CDC said it, whatever. The CDC does in fact have a history, like the EPA and the FDA. If you want to do a little bit of research into what it means for these regulatory bodies to be captured, there's something called regulatory capture. I didn't make it up. It's not a conspiracy theory. It's factual. So do a little more research, I would say. When you're talking with people, I would say we had one speaker appeal to appeal to authority. The last speaker appealed to the influencers, and that if you disagree with the official narrative, the influencers that you're accessing certainly must be their logic must be flawed, their science must be flawed. Well, you know, I can point to, just for instance, I have a massive folder on Pamela Popper. But check out Pamela Popper. She's absolutely, completely against the mainstream narrative. Thank God there are people like her out there. She's got a long history in healthcare. I've been following her for a decade at least. But she wrote a great paper. And what I loved about the paper, which is different from what the articles my father sends me, they're just opinion pieces. The articles that she writes, they actually have sources on there. So for example, this one about are masks protective against COVID-19? She has, let's see here, how many sources. Looks like this article has 15 different sources from scientific studies going back to 1990 that talk about how masks don't work for viruses in particular. If you talk to someone in healthcare, and if you talk about a viral situation, a dangerous viral situation, you will see people in suits that have an air supply, and the masks are pretty intensive. So on the subject of mandating masks, that's ridiculous, of course, because I don't believe the official narrative in any way, shape, or form. But if one were going to go down that slip, taking away human rights and American rights, if you're going to go down that slippery slope, then you know, the masks have to be the ones that actually are form-fitting, because making one out of a sock or out of your wife's brassiere or out of someone's underwear or out of a bandana, that's ridiculous. We know that does nothing at all, okay? We have a lot of proof about that. If you question what I just said right there, if anybody in the world questions what I just said right there, dig a little bit deeper. Honestly, if you're a Fox watcher, be brave and go over to CNN for an hour, and vice versa. If you're just stuck on social media and all of your friends agreeing, go over and read a little bit of science. Dig a little bit more than just going with your consensus that you have based on what you're hearing on Facebook, based on what you're hearing on the television. Actually dig deeper and find some statistical studies that talk about the science behind this, the medical science behind this. Because I think that what I'm hearing is a bunch of, not just you folks, but generally a bunch of really, really lazy people. They love their television shows, and what? They spew out, they regurgitate what they hear. They take this in, this information in, then they regurgitate it out. I'm a researcher. So you can either be a regurgitator of mainstream garbage or you can be a researcher. Become a researcher. It's difficult, by the way. 30 years of research. If anybody there thinks you can research better than me just because you're a Facebook aficionado or you love your television news, you're wrong. Research is difficult. Research involves digging, just like science. Yes, sir.
John, you have the last 15 seconds, so just finish it up.
Science is not about consensus. If it was, we would all still believe the world is flat. The world's not flat. Science is about discovery, right? So the scientists coming to disagree with Fauci, they're getting pushed away. That's not science. It needs to be looked at much more deeply. Stop being lazy, people. Turn off your friggin' televisions.
Thank you very much, Mr. Speaker. All right, I am looking forward to this. So we will take 3 questions and no more than 3 questions for the speaker. And I kindly ask that each of these questions be in the form of a question directed to me. All right. First question will go to Terry Webb. Terry, please unmute yourself and ask a question.
Thank you, Mr. Chair. I have a question to ask the speaker. I wasn't sure. I'm a researcher too. I write historical fiction, so I do a lot of research. And I'm also come from a mental health background, and I'm an expert in some of my issues. But I have a question about whether you are questioning
whether the speaker is.
I'm sorry, Mr. Chair. I have a question for the speaker. The speaker talks about seem to be very negative about some of the science in terms of wearing masks, and I'm wondering what's particular. Can he give me an illustration or an example of the research that he's found that masks, that masks that are made out of cloth don't work, and that masks that are made with the breathing thing work better, or that masks that are made with plastic work better? Does he have any research indicating those?
Thank you very much,
answers to that question.
Thank you, Ms. Webb. Mr. Speaker.
Well, thank you, Mr. Chair. Thank you, Speaker. Yes, I have a massive amount of information I could share with you. I don't know the best way to do that. I could give you my email address if I can. Am I allowed to say that here? I don't mind. It's jcbarrett2003@gmail.com. That's jcbarrett2003@gmail.com, and I can send you over a massive amount of information for me to be able to sit here and be able to go through just from this one article. I'm going, it's talking about preventing transmission of pandemic influence and other viral respiratory diseases, going back to a study from the National Academy of Science, 2010. I mean, I can go on and on and on. Hundreds and hundreds of case studies with masks, which ones work, which ones don't. So that's the best I can answer right now without, I'm happy to send you as much information as you would like. I could probably drive you crazy sending you emails. I have no doubt, sending emails to the speaker, no doubt.
Well, in that case, let's get to the next question while these emails are sent. And don't worry, being somebody who works with Braver Angels, I know that it is very possible to drive people crazy sending them emails, because I do it all the time. So, all right. So we will take the next question from Joe Bainey. Joe, please unmute yourself and ask a question of what the speaker said.
Yeah, hi. I actually don't directly have a question, but the last speaker, John, I fully agree with him. I have read so much stuff, the microbiology people that really know what that's all about. The masks are a complete farce. It's just the best analogy that I've heard.
Mr. Bainey, we have to hold the floor for questioners at this point. But thank you for your comment, and I'm sure the speaker appreciates the appreciation.
Sure. Okay.
Thank you. All right. Let's call on. Let us see. Devin Musser. Devin, would you like to unmute yourself and ask a question of the speaker, please?
Yeah. Thank you, Mr. Chair, and thank you to the speaker. I'm really interested in the science myself, trying to understand it, because it has seemed to shift over time. From the beginning, there was some, confusion whether masks were effective or not, and clearly it takes some time for the science to develop. And given that, this is really my question, given that you can't ethically have a control group, right, in the midst of a pandemic, You can't instruct people, don't wear a mask. That would be unethical to test whether they are effective. Given that, we look around the world and we see the countries where they culturally wear masks, they have lower death rates, they have lower infection rates. When we impose mandates here, those jurisdictions have lower death rates and lower infection rates. And that's the science, as I understand it, that the mandates are based upon. I'm just curious if the speaker accepts that as scientific evidence or not.
Thank you, Mr. Musser. Mr. Speaker.
Thank you, Mr. Chair. Thank you, Questioner. I would challenge you to look at what science you have read. We'll look at what studies you've read to support what you just said, or is that something that you're hearing? I'm going to guess it's more along the lines of kind of a hearsay. Look, we have coronaviruses going back to 1967, so they've been studied. We've had viruses for a long, long time. They've been studied. We know how they work, and we know that a bandana absolutely does nothing whatsoever. So I would also refer people to, even though the Fox News is hated, I hate Fox News, I hate CNN, I hate all of the mainstream news because it's garbage. But hey, look, people who were afraid to watch Fox News, guess what you missed? You missed 10 minutes of your own Jerome Adams, right? You missed 10 minutes of Jerome Adams saying, he spoke for 10 minutes about how masks don't work with viruses. Did you guys miss that? And then shortly afterwards, Dr. Fauci, the great Emperor Fauci, what did he do? He said the same damn thing, right? But then they backpedaled, flip-flop Fauci, Tony the phony Fauci, backpedaled. What did he say? He said, oh no, the reason that was said, not the reason I said it, the reason that was said was because we were trying to make sure there were enough masks for healthcare professionals. What a bunch of garbage. Healthcare professionals have everything that they need to fight real pandemics, right? Sadly, this is not a real pandemic. People shaking their head, I understand that. Look, if you're shaking your head, you disagree with me, bring to your own table, within your own family, some science. You know, study some science, turn off your television, stop reading garbage, and stop believing consensus means it's real. It's not real. Consensus is not science. Discovery is science.
Thank you, Mr. Speaker. We'll take one last question for the speaker. And as a quick note, the chair does not approve of the use of swear words in any speech, but nor does he condemn them by any speaker. So no worries on that front. All right, last question for the speaker will be Ellen Kay. Ellen, please unmute yourself and ask a question of the speaker. Ellen? Let's see. All right, perhaps Ellen didn't hear me. So in that case, let's take a question from Will Jones. Will, would you like to unmute yourself and ask a question of the speaker?
Thank you, Mr. Chair. Thank you to the speaker as well. I'm curious, do masks stop droplets?
Thank you, Mr. Jones.
And are droplets, and do droplets not contain the virus that is causing COVID? Thank you.
Thank you, Mr. Jones. Mr. Speaker.
I don't think you want to hear my. I don't think you want to hear my answer. Thank you, Mr. Speaker. To the questioner, to the speaker. Thank you, Mr. Chair. I don't accept the premise that you do to begin with. I don't accept the premise that this coronavirus has a mortality rate that is any more dangerous than the other ones. It is spreading much more quickly, but if you go back and listen to the Stanford professors, in early March, they were saying that here's the bad news, folks, we've got bad news. This coronavirus, like all of the other ones since 1967, is going to go through our entire population and there's no way to stop it, and that's a fact. Okay, so everybody either has or will come into contact with this particular coronavirus. And guess what? This year you came in contact, thousands of people, millions of people came in contact with the other coronaviruses. It's not a one virus year. It never has been. It never will be. This coronavirus will be here next year and 20 years from now, as will the swine flu, as will the bird flu. Get it? Right? That's the problem. Okay, so if I can't accept your premise that this is a pandemic that's going to kill everybody in the world, you know, I can't accept that. I can't accept the numbers are correct. I can't accept the mortality rate we've been given. I can't accept the official narrative, especially considering how great this is for controlling people, and add to that the fact that the federal government here in China, in Japan, in Europe, the federal governments have robbed from the American people. In particular, by the end of this year, something close to $10 trillion. Hey, don't blame Trump, right? blame the Federal Reserve, blame the people who are really in power, who will be there long after Mr. Trump is out of office.
Thank you very much, Mr. Speaker. So we're going to go ahead and move on to the last couple of speakers here. But real quick, I just want to give the speaker a round of jazz hands, because I think it's clear that he knows he's in the minority on some of these things, but he's courageous enough to speak his mind to us and share perspectives that we might not otherwise have heard. So thank you very much, Mr. Speaker. All right, so with that, we're going to get down to the final 4 speeches, and I'm actually going to ask the speakers that we move down to 2-minute speeches from 4-minute speeches, just so that we can get everybody in. And we will not do questions after these speeches either, just for the sake of getting it. But we have 4 last speeches ready. So with that, Deborah Pine, please unmute yourself. You have 2 minutes for your speech.
2 minutes. I had 4 minutes worth of material, so at least. So let me just run through my thoughts. First of all, there's excellent evidence that masks do help reduce the spread of the virus. There is evidence that in the laboratory it reduces it. All the way down to 2 layers of cotton reduces it about 80%. That is laboratory evidence. There is excellent evidence in on a national basis that it reduces it. The countries that have had mask mandates have done much better as far as mortality and transmission rates. And for example, Japan and some of the other Asian countries had far shorter close downs. In fact, Japan hardly closed down at all because of almost universal mask usage. The mask allows us more freedom to return to normality. It shortens the course of the upswings of the epidemic. So we have a much improved quality of life, improved economy, return to normalcy, all the things that we are talking about wanting. So if we could come together and do that, we could make a huge difference in how our country is functioning. There is recent evidence as of last week in New England Journal of Medicine that masks also have an impact of vaccinating us. And when I say that, what I mean is the mask reduces the transmission or the viral load that people get enough that instead of having high viral load and high disease rates, they have asymptomatic transmission. So they are protected by using masks. People wearing masks protect others by giving them a low viral dose. So it's sort of like an inoculation until we have an actual vaccine. I don't know how much time. Is that it?
You have
okay.
30 seconds.
Okay, 30 seconds. Roughly 40% of the transmission is asymptomatic, so you don't know when you need to wear a mask. So everyone needs to wear one if we're going to cut down on transmission. And just a point of clarification, the death rate, the actual case fatality rate is 3%. In an average year, flu is between 0.1 and 0.2%. So it is way more lethal than flu, just for clarity. Thank you.
Thank you very much,
Mr. Chair.
With that, the speaker is thanked. All right, we're going to move on to another speech in the negative. I believe I saw Dennis Mahoney. Dennis Mahoney, would you still like to give a 2-minute speech in the negative?
Yes, thank you. I will.
Great. The floor is yours.
I think that this is not really so much in the negative. I'm calling it that because it's probably a little bit more negative than positive, but I'm really just raising an issue. Remember, the original focus of this talk was, of this debate was, should the federal government impose a mandate? And anytime we get into talking about what the federal government should do, then we cannot ignore the elephant in the room. And the elephant in the room is the United States Constitution. And then that in turn could be divided into 2 issues. Constitutionally, could the federal government impose a mandate by executive order of the president? And can the federal government impose a mandate by act of Congress? Looking at the first one, when it comes to could it impose the mandate by executive order, I think the answer is clearly no. I think it's worth looking at what the top of the Democratic ticket recently said on this. Joe Biden, initially he said that as president, he would impose a national mandate, came back a few days later, reversed his position because he had talked to constitutional scholars who my assumption would be that they were left of center. And these scholars said that, well, that would be unconstitutional. What Kamala Harris has said on the subject is that any rule by the federal government would actually not be enforced. Well, if it's not enforced, then it's not really a mandate, it's just a suggestion. So there could be no executive order imposing a national mandate. Now, whether there could be an act of Congress, I think that's a closer question. On the one hand, we are supposed to be—
30 seconds, Dennis.
Okay. All right, then I'll just have to wrap this up really carefully. There would be, it's a closer issue on act of Congress. I suspect that none of us knows the answer to that. The Supreme Court would probably decide 5-4 one way or the other.
Thank you very much. With that, the speaker is thanked. All right, so let's go over to Stan Levine. Stan, would you like to give a 2-minute speech in the affirmative on this resolution?
Yes, Mr. Chair, thank you very much.
As
has been mentioned before, the question is whether or not the federal government should mandate mask wearing. Right now, we have mixed messages from the federal government. People are confused. Wear a mask, don't wear a mask. Does it protect me? Does it protect somebody else? A mandate alone would help clarify that, whether it was enforced or not. Number two, not all viruses are the same. They transmit differently. They are different sizes, etc. I happen to be a researcher. I have been for 50 years. I'm an analyst, and I'm also a physicist. If anyone is interested, check out the study, Respiratory Virus Shedding in Exhaled Breath and Efficacy of Face Masks. Face masks do not 100% protect anyone. However, they reduce the chances of you affecting somebody else. It is one of the purposes of the federal government is to prevent people from harming others. So there's another question. It's not for your protection, although you might get some, it's to protect other people. We have all kinds of laws that do that already. So this is just another law. People are not free to harm others. The key is that it will reduce the load on our medical system and maybe put it off long enough for us to get either a cure or something that will either prevent it or will help us get over it if we catch it. I do believe that probably 80% or more of us will get it. Okay. However, if we can put it off long enough for science to come up with either cures or preventative or something that will help us survive, then there'll be less load on the medical system, which means people with other diseases won't die because there's not a bed available, et cetera, et cetera. The key is being selfish or not being selfish. The government can help us try to prevent people from hurting other people.
Thank you very much, Mr. Levine. With that, the speaker is thanked. All right, so we're going to go on to our last speaker of the evening, which is going to be one of our whips, Terry. Terry, feel free to unmute yourself and give us a 2-minute speech in the negative to close us out.
Thank you. Well, Stan beat me to the punch on several things. So I could have gone either way, positive or negative, because well, on the negative, I do wish that rather than focusing on mandates, that we could focus more on education. And like John has kind of said, like real education, so that we're kind of getting the best information that we can. And so just kind of based on that, I also just kind of wanted to talk about a couple of things that I have noticed I didn't come up. So I'm a biologist, I'm a researcher, so some of the things that that were brought up that I just kind of wanted to comment on, and Stan mentioned some of this as well, is that we know that masks are not 100% protective. I mean, there's no doubt about that, but they have been studied, and they have been studied with COVID. They've been studied in the lab, and we know that they do prevent the amount of virus that is expelled, and that viral load affects how sick you get. And that's true with any virus. It's not just COVID. A couple of other things about this particular virus, you know, the fact that it is new, it's not SARS-CoV-2 19 because it's the 19th, it's because it started in 2019. And of course there are new viruses are, you know, developed, but it is actually, it's not a respiratory disease, it's a vascular disease. And so it's causing organ damage throughout the body. And this is a real concern because what it means is that for the population who don't die from the disease, they could end up with long-term or lifelong organ damage.
Terry, 30 seconds.
All right, thank you. So anyway, let's see. And so part of it too is that because none of us have ever been exposed to this before, that as Stan mentioned, that at least probably 80% of us are going to be sick from it. And hopefully not too much. Hopefully our viral load will be low enough because of protection of ourselves and others from masks that we just get a little bit sick, and that will give us a little bit of immunity. And I also wanted to address the question about different types of masks and recommend going to Consumer Lab. They have actually tested out different types of masks or looked at, analyzed tests of different types of masks. So.
With that, the speaker is thanked. Thank you very much, Terry. All right, so we are actually way over time, which is always an excellent problem to have with Braver Angels debates, because that just means it was a raucous debate. So I would smile upon a resolution or upon a motion to adjourn the debate. Do we have a motion?
So moved.
Do we have a second to that motion?
A second.
All right, with that, the debate is adjourned. But don't go away just yet. We have one very brief checkout thing to do, and then I'll give the final spiel. But real quick, so there are always two questions that we ask everybody, and just try to have a little bit of reflection after one of these debates. We won't have a lot of time to get through a lot of this, so please feel free to send emails to the media at Braver Angels email with any thoughts or comments you have on the structure and everything. We always ask people as they leave the debate, did anything you saw or experienced over the course of this last 2 hours of debate, did you enjoy anything about it? So feel free to unmute yourself and say anything that you might have enjoyed. So.
I've got one, Mr. Chairman.
Go ahead and say it.
Hey, there was a lot of preparation put into this one. I've tried to attend many, but everybody was really thoughtful, and just, you know, it's great to see everybody carrying whatever side, yay or nay. Really good stuff, because I'm still, I don't know what I think about this yet. So I appreciate everybody's stuff.
Thanks for being here, Roger. Anybody else enjoy anything?
Hi.
Yep.
Lydia Molyneux. While this did not change my opinion about the efficacy of masks, I am pro-mask, it did make me consider what it would be to actually have the government get involved in regulating us, and what civil liberties may have to be altered, given up, whatever, if at all. Okay, thank you.
Thank you. Glad that you got something from it. Anybody else enjoy anything in particular?
It's Christine, and this is my first Braver Angel event.
Welcome.
So I thank you for the civility. I enjoyed that. and I got to hear different, I enjoyed that. Thank you.
Thank you for being here and welcome. May it be the first of many. A couple more people, anything you enjoy, and also perhaps anything that might have surprised you in a good way.
Something that I thought of, which I had not thought of before, is the issue of enforcement. Then that's a question that needs to be part of this discussion. And I knew it because our local sheriff got frustrated with trying to enforce that when we had it in place. Now it's not. But anyway, the police are having a difficult time as it is, and they are not going to make themselves any more popular if they have to start enforcing mask wearing. That's all.
That's an interesting point as well. Thank you for bringing that up. All right, let's take two more just comments. Feel free to unmute yourself and shout it out on what you enjoyed or what you found surprising in a good way.
So I'm so sorry. Just Mark in Seattle, I just want to say I really appreciate it. I liked when John was speaking. John, you really helped me just hear more. And I felt like I did get more being in the presence of all of you tonight than I would have had I been watching television. You caused me to think about the layers and uncover complexities and the perspectives that you brought. I know I'll be thinking about a lot of things that people brought up today, tomorrow when I'm out for a walk with my mask on. And so I wish you all well, and thank you, Braver Angels. Thanks to all of you.
Thank you for being here. All right, we'll take one more and then I'll do the closing spiel.
Yeah, I'd like to speak. I've never been to a Braver Angels event before, and I really enjoyed it. I felt like I got a lot of, I didn't say anything because it was my first time, but I learned a lot by listening to different people's point of views that I would not hear otherwise. I live in Santa Cruz, California, and most people have the point of view I have. So for me, it was really wonderful to have an opportunity to hear how other people are thinking and what's underneath their thoughts. And I hope to come back to many more events.
Well, thank you, Laura, and thank you, Mark, and thank you, John, and thank you, everybody. And thank you to my wonderful whips, Terry and Stuart, and why am I forgetting your name? George. Sorry, George. Thank you, George, as well. Then additionally, Braver Angels is an organization run by volunteers. I'm a volunteer. These three whips of mine here are volunteers. We're all volunteers, and there's a small staff and there's a small operation with people around the country. But the vast majority of people who work in Braver Angels and bring this stuff to you and to our fellow citizens in this most divisive of years are all volunteers. And so on behalf of the Braver Angels community, to all of you, I encourage you to click that second link, the Braver Angels /support us, and figure out ways you can get involved if you like. We're always looking for more people to join us. We need people in every city, in every county, all over this country, all over this broad land, because there's a lot more Americans beyond everybody here. In some ways, everybody here represents some parts of the diversity of America, but there's so many more people who are as influenced by politics and the polarization and division in this country as you and me. And I really believe that at this particular moment in history, one of the most patriotic things anybody can do is work to bring Americans together at a time when Americans are tearing each other apart. And we offer everybody the opportunity to help us build a house united and bring a different way, not necessarily a third way, not necessarily an independent way, but a better way of politics than what we've been used to for so long. Braver Angels does these kinds of debates. We do one-on-one stuff. We do workshops. We have a lot of media offerings, and we do all kinds of other programs. And we are, especially as the pandemic eases up, hopefully sometime in the near future, we'll be doing in-person events as well once it's safe to do so. So this is something that is going to be existing long past the election. It's a great community, a great network, a great family, and I would just encourage you, if you are so interested and so willing, to click that link and figure out how you can get involved. So, but I've spoken too long. Braver Angels really helped me on a lot of my own personal thoughts and my own personal issues, and it opened my eyes to a different way of thinking about my fellow Americans and how we live together. And I just want to let you all know that you are very welcome to come and join us and figure out some of that same stuff too. So with that, thank you all for joining us. I'll keep the window open for just another minute longer here so that you can click those links if you like. But thank you for joining us, and we look forward to seeing you at hopefully many more Braver Angels events online in the future. Have a good night, everyone.